My name is Rochelle Fu, and I'm a associate professor of biostatistics, and I'm working at the Oregon Health and Science University. I'm also the lead biostatistician of the Evidence-Based Practice Center here at OHSU. I think the controversy really started is, in the earlier publications of the Medtronic-sponsored studies, they do not report any adverse events. Then later, when the surgeons started to use them, they started to pick out adverse events in their practice. So there, in the later published publications, by they are, not sponsored by, Medtronic. They started to report all these adverse events. Then in 2008, FDA issued a public health notice about some potential life-threatening risk, about the use of the BMP, like neck swelling, compression of the throat. So they may cause some, breathing problem. So the Medtronic provide us, all their independent, all the individual patient data of 17 studies that were completed or terminated by 2011. They also gave us all the internal documents, their report to FDA's, the data dictionaries, and some brief history of the adverse events. So in the industry trials, I believe, the outcomes were, come up with the, talking with FDA. So they have their primary outcome as overall success, which, is a composite outcome measure that including both the effective outcomes and some potential adverse event. They use that as the primary outcome in some of their trials. Then in some other trials, they use fusion as the primary outcome. They also looked at the some like patient-centered outcome, like the pain, disability, general health, return to work. So they do look at a series of different outcomes there. Yes, there are two trials that were stopped early. One trial was stopped, when they got probably half of the patients enrolled. For that study, we do not really know the exact reason, and based on the Medtronic internal document, decided that the business, was the reason they stopped the trial. There's another trial that has been done in a procedure, what do we call the PLIF, the PLIF. That trial was terminated early because some patients has some extra bone growth, the ectopic bone growth. So that trial was stopped early because this potential adverse event. So, in our study, we looked at both the effectiveness and harms of IHBMP that, used in span fusion. We also looked at the potential reporting bias. So, in terms of the effectiveness, we found that, there's no additional benefit in the in using BMP compared to the more traditional used method, use the bone graft. We looked at all the different outcomes, for example, the overall success, the fusion rate, the disability, the pain, the general health. Among those of, effective outcomes, we do not find any, consistent difference between the two groups. In terms of harms, the harms in the cervical span fusion is more demonstrated. We have like more conclusive evidence, about their dysphagia, neck swelling, adverse events like that. We also found increased risk of cancer at 24 months. And then in terms of the reporting bias, we do find substantial evidence, that the early published articles of the Medtronic-sponsored trials, that has substantial reporting bias. Their published results try to overstate the benefits but play down the harms. In some of the studies, there's just no harm reported. Based on our evidence, it's hard to find a clear indication to say, like in what area, in what people we should, in what procedure we should use this. Based on the editorial from the Annals of Internal Medicine, because they always increase the risk of cervical span, you probably should not use this one in the cervical span. In all the other, procedures, we do not really see a clear advantage for people to use it. The relative risk, the estimate of the risk ratio is 3.5, so it means the risk of cancer in the BNP group is about like 3.5 times the risk in the group use bone graft. So it's 1.9% higher. So in the RHBNP group, the risk of cancer is about 3%, and in the other group is about 1%. We do get significant results, but as we already mentioned, the event rate is low. Also, we include many types of cancers, so we should look at the results carefully. There are all the different types of tumors like breast cancer, prostate cancer, skin cancer. Based on the animal studies, the animal studies does not really see BNP is causing cancer, but there are some studies that did show the HBNP or this protein is promoted by some type of the cancer. So based on the cancer occurred, like our evidence to show the cancer occurs like within 2 to 4 years. So maybe it's more argue for a pro-oncogenic mechanism. While I think for our review, for this study, it really emphasized the importance of a unbiased, independent review of all this individual, data, to be able to inform the public better, to inform the clinicians and the patients better, to help them to make better judgment on the balance of their effectiveness and harms. So hopefully our results could be useful to FDA too. Okay, so for this process, Medtronic and Yale worked together, and Medtronic provide $2.5 million to support this effort, to do the reanalysis of the individual patient data. So Medtronic provided all the money and the individual patient data and the relevant documents. For Yale sent out the RFPs to recruit 2 independent review groups to work on this one. So we were picked as one of the reviewing group.